Hello, hello, and welcome to A Roadmap to Equity in SNAP Ed, a position paper by the Association of the SNAP Nutrition Education Administrators, the Race, Health, and Social Equity Committee. Thank you so much for joining us today. We are really excited to have this conversation with each and every one of you. And at the end, we'll have Q&A. Next slide, please. Welcome. Thank you for attending. We're excited that you're here. We want to invite you to review the guiding principles. For us, they will be centering people, authentic community engagement, start with strengths, impact over intent, integrity, transparency, and accountability, and cross-sector partnerships. These guiding principles have been embedded throughout the work that we are doing, and some of it is applicable to the work that we do, and some of it is applicable to how we approach this work. And so I invite you to think through how these guiding principles might lead and guide the work that we discussed today. Next slide, please. Some community agreements. So like I said, we're really excited that you're here. We ask that you be present, be respectful, create space for multiple truths, assume the best intentions and recognize that impact is different than intent, center learning and growth, and get curious and ask questions. The Q&A function is available to you, and I believe is a chat function available, I can't recall. But if you have questions, please feel free to put those in the Q&A, and we will do our very best to respond to them. Next slide, please. Okay. So before we start, I just want to ground us in what this webinar is. This webinar is an opportunity to explore the upcoming release of the position paper, A Roadmap to Embedding Equity in SNAP Ed. It is not an open discussion that questions or challenges the existence of racism, injustice, and inequity, nor is it a place to question the validity of learning about race, racism, equity, or white supremacy. There are resources that we can point you to, but that's not the scope of this webinar. We think that the people that we serve that have been most harmed from disinvestment, discrimination, and disenfranchisement are in the best position to guide solutions. We believe that people are the experts of their own lives, and that sustainability should include building community power through community championships. We also ultimately are accountable to the communities that we serve. So we know we have lots of stakeholders and lots of people that we need to be accountable to. We also need to position ourselves in a way and make sure that we are also accountable to the communities that we serve. Next slide, please. A little bit of housekeeping. Like I said, please use the Q&A feature to ask questions, and that's all the way at the bottom. If you scroll there on your mouse, the chat feature will be enabled to communicate thoughts. I'll double check on that. Training will be recorded and posted on all host websites. So I know we get this question every time we do a webinar. Yes, the recording will be available. We'll make sure to get that to you after the event. So in the event that you have other colleagues who are unable to attend today, we are recording. And we will also send out a survey link following the training, and we really encourage you to complete that survey to let us know about this webinar and to guide our work in the upcoming years. Next slide, please. And so how it's going to work today is that I will do kind of background and framing of the position paper. Then we will invite our panelists to talk through their content, and then we'll have closing remarks, and then we'll have question and answers. So they'll be at the end. We'll try to answer as many questions in the Q&A as we can throughout, and any that we can't, we'll try to lift those up during the Q&A. Next slide, please. Okay. Today's objective is to provide a brief background and overview of the position paper, introduce topics and processes to redistribute power and advance equity, Discuss components of equity that can be addressed throughout the SNAP Ed life cycle. Next slide, please. So as an introduction, the ASNA Race, Health, and Social Equity Committee invited authors to draft essays on relevant topics to co-create a new vision for how SNAP Ed can contribute to the equity ecosystem. The primary audience for this work is staff at the USDA, Food Nutrition Services, and the Nutrition Education Branch, state agencies, local implementing agencies, and state implementing agencies. That was our primary audience. Our secondary audience is also folks who are just interested in advancing equity in this work. So that could include community members, it could include other decision makers, partners, who might also be interested in how they can support really advancing equity in this work. A Roadmap to Equity in SNAP Ed is a collection of essays that addresses various topics, and most include questions for the readers to consider and boxes with recommendations that highlight action items to advance equity in each topic area. So most of our authors have really thought through their work in SNAP Ed and the concepts around equity, and have kind of included how we can make that that equity work relevant and present in SNAP Ed. And so we're really excited that we will soon release the position paper. It should be released within the next week. And this is a table of content. And if you can look through it just quickly, we have some really interesting topics around expanding how we are defining health, discussing the race, health, and social equity and SNAP Ed framework model. How can state agencies and state and local implementing agencies act as change agents? How can we consider equity within our organizations? How can we explore participatory grant making as a way to shift power? How can we center equity in developing relevant programming? How can we advance equity through evaluation, exploring an equity-centered evaluation framework, and exploring participatory evaluation in SNAP Ed. So those are the key concepts that we'll be going over. And here are our authors. And I just want to thank each and every author here. They have been valuable in their time and in sharing their expertise. And so thank you to each and every one of you. Although we invited all the authors to share today, not all authors could coordinate their schedules. So there will be some topics that will be presented today and others that will be only included in the position paper. So today, Dr. Mary Marchek and Dr. Craig Hassel were unable to be here, so we'll start with Dr. Amber Canto. So we are defining equity as meaning fair and justice for everyone, both in process and impact, regardless of racial, cultural, economic, or any other identity. Whereas equality provides kind of a one-size-fits-all solution, equity really recognizes that we are not starting off in the same position, in the same place. And we need to acknowledge that and make adjustments to systematic imbalances and differential redistribution of support according to individual need. So this will be really important because what this paper will try to do is, how do we make those adjustments? What does that look like in the work that we do? Based upon the parameters that we have to do this work, how can we really make this this definition applicable to the work that we do? And so we explore those topics here. Next slide, please. So the first chapter was proposing a definition of health with an equity lens. This is really foundational in kind of how we looked at our paper. Unfortunately, Dr. Mary and Dr. Hassel, Mary Marchek and Dr. Craig Hassel were unable to present today, but I invite you to read their chapter in the position paper. Next slide, please. And I will hand it over to Amber Canto.
Thank you so much, Latrice. Good morning, I believe, still morning. Good morning, everybody. I'm Amber Canto, and I work with the University of Wisconsin-Madison Division of Extension, and I direct our Health and Wellbeing Institute, which is the organizational home of our SNAP Ed program. And today I'll be presenting to you the Race, Health, and Social Equity in SNAP Ed conceptual framework that is included in the position paper, A Roadmap to Equity. Next slide. So why develop a conceptual framework? Conceptual frameworks help organize and integrate information. They provide a visual representation of domains of influence on a behavior or outcome. And really, in the process of developing this framework, we identified several frameworks and models that depict actions and practices that are designed to advance health equity across organizational systems and in community settings. But the system in which SNAP Ed operates is unique, and we know that this unique context influences how we think about and approach our efforts to advance health equity. Next slide. So the process we took to develop this race, health, and social equity conceptual framework included a review of existing literature. This included both peer-reviewed articles as well as Black and brown, white and gray literature that is available. And developed an initial framework that was then shared with several members of the ASNA Race, Health, and Social Equity Committee. Those members provided feedback on the framework, and then we finalized the conceptual framework that you see in the position paper. Next slide. So there is a lot here in this slide, but I'm going to break down the conceptual framework in the slides that follow and just highlight briefly some of the key components. And I encourage you all to read the position paper and dig in deeper around each of these domains. But the first thing I wanted to highlight in this conceptual framework is the interrelationship between the key domains that support institutional actions that embed equity as a process. And this action framework is really based on the premise that we all have a role to play in advancing health equity. And in particular, the framework acknowledges the positionality of SNAP Ed agencies as change agents, excuse me. You'll see that the conceptual model builds from ASNA's guiding principles and shared values around equity. And again, these guiding principles include authentic community engagement, starting with strengths, impact over intent, integrity, transparency, accountability, cross-sector partnerships, and centering of people. And when we talk about holding race, health, and social equity as a shared value in SNAP Ed, we mean this to be that all state and implementing agencies have a collective commitment towards understanding their shared responsibility in advancing health equity. This framework also builds from an understanding that achieving health equity is both a process and an outcome. In other words, our administrative practices, our operations, and our organizational environment, as well as how we approach program development, implementation, and evaluation, are all critical to achieving equitable health outcomes for all. And this framework, again, recognizes that there are mutually reinforcing relationships between these key domains of organizational environment and the things that guide our equity process, as well as our outcomes along the way. Next slide. So what are those outcomes that we're hoping to achieve? Our SNAP Ed goal is to improve the likelihood that persons who are eligible for SNAP will make healthy food choices within a limited budget and choose physically active lifestyles consistent with the current dietary guidelines and USDA food guidance. And within the context of this framework, we believe that achieving race, health, and social equity in SNAP Ed means that there's no observable difference in diet and physical activity indicators and related health outcomes across social groups. Additionally, environmental determinants of nutrition and health outcomes, such as food and built environments, would present fair and just opportunities for all individuals, regardless of social group, to make healthy food choices and choose physically active lifestyles. And again, to achieve these outcomes, we posit that we need to consider and adjust our processes to guide more equitable organizational systems, practices, and prioritize planning, implementation, and evaluation strategies that center community. Next slide. So from an organizational environment domain, what we describe here is how our organizational environment influences the overall climate and the support for addressing equity through operational and programmatic practices. Senior leaders play a key role in defining a commitment to advancing equity and accepting accountability for advancing equity through workforce development, staff development and training, and resource allocation. Next slide. In the case of program development and implementation, here we talk about centering the voices of those that are most impacted by inequities through participatory program processes, prioritizing program strategies that are more likely to lead to equitable outcomes. And this includes policy systems and environmental change approaches, and culturally and linguistically appropriate efforts. Program development and implementation should also be responsive to community assessment efforts that reflect community assets and community identified issues. And again, we emphasize the role of cross-sector partnerships being in place to support action on equity-oriented interventions. Next slide. The final domain refers to centering equity in SNAP-Ed program evaluation. Here again, we acknowledge the importance of incorporating participatory processes into program evaluation. We encourage starting with community assets and strengths, and acknowledge that data should be disaggregated and contextualized to reflect systemic inequities. It's also important to consider that data ownership should be shared with communities who are most impacted by health inequities. Next slide. So here are some recommendations for how we can move this conceptual framework into action, and I'll start with our USDA funding partners. So we encourage the recognition and appreciation of the role that USDA plays in supporting SNAP-Ed's movement towards a more equitable program. We can consider opportunities for our program guidance to reflect a commitment to health equity systems practices across multiple domains and program functions. Again, this includes our operational and our administrative practices, our program development, implementation, evaluation, as well as our reporting. We can hold space for listening and learning from state agencies and implementing agencies about their experiences in centering health equity systems practices, and provide thought partnership and guidance in support of advancing health equity goals within the SNAP-Ed program context. Next slide. And some recommendations for state agencies and implementing agencies include identifying and adopting actions that advance health equity systems practices across multiple domains. Again, these are the operational and organizational environments, our program development, implementation, and evaluation. And really recognize here that our individual actions within each of these domains can influence our other practices across other domains that support advancing health equity. We can identify points of coordination and alignment with diverse network partners who represent multiple sectors of society. And we can identify and support health equity champions at all levels within our state agencies and implementing agencies. These health equity champions can advise on systems practices for advancing health equity and help hold accountability towards these equity practices. Next slide. And I'll just leave you with a few reflection questions as you have a chance to dig in deeper to the conceptual framework. Where do you see evidence of current practices in advancing health equity approaches within your implementing agency or state agency? Which domains of the race, health, and social equity conceptual framework feel most actionable for you to explore and act on? And why might that be? Which domains of race, health, and social equity conceptual framework feel most challenging for you to explore and act on? And why might that be? And what is one thing you can commit to exploring further in support of adopting or improving a health equity systems practice? Next slide. And I just want to briefly mention that this conceptual framework is also serving as the basis for a mixed methods research study that hopes to assess the adoption of health equity practices among a sample of SNAP-Ed implementing agencies across the country. This project is currently underway, and we hope our findings will result in tools that support further reflection and action around approaches to advancing health equity in SNAP-Ed, as well as broaden our understanding and awareness of current practices. Thank you so much.
Will be me. Okay. State agencies and state and local implementing agencies as change agents. Angela Amico wrote this section when she was the SNAP Ed program manager for the Washington State Department of Social and Health Services and a member of ASNA's Race, Health, and Social Equity Committee, but is unable to present today. So I will present on her behalf. Next slide, please. State agencies and local implementation, state and local implementing agencies are important change agents. I think the most influence that they can have is really supporting communities through investments. And so if in your role at a state agency or a state or local implementing agency, you have the ability to decide who, what agencies get contracts and how much they are funded. That is a lot of power. And you also have the ability to make sure that those processes are more equitable. It's important for staff responsible for those contracts to become familiar with the rules and guidance of procurement. And so this will be really important as you kind of think through how to make that process more equitable if you understand the parameters and the rules that you have to navigate. Next slide, please. Some key points, is to consider a contracting model that will allow for more localized community development, which if done intentionally can really elevate community priorities and approaches. So these are things like engaging community members and selecting or recommending community-based organizations, nonprofit organizations, engaging in the type and how work is completed. Consider how SNAP-Ed funding can build capacity for community-based organizations. So sometimes it can be specifically for program managers, it could be really difficult to expand the number of contracted partners because that is additional work. And so you want to be able to be thoughtful about how you in your role can think through ways that you can make the contracting process a bit more equitable. And we'll talk through some of those ways in a little bit. Next slide, please. So consider going through an open bid process. There are, pros and cons to open bid. This is typically where you open it up for everyone and you have a set deadline. All bids need to be in by XYZ deadline on this day. And, it does have the potential to increase the number of bidders or contractors or vendors. It does avoid favoritism because there is just one deadline, there's one application. It's a standard process for all bidders. I think the challenges are it's not an inherently equitable process. And there's a couple of reasons why, depending on the requirements, the number of forms, the kind of information requested, the background of the agency, how things are scored. Those kinds of questions aren't may or may not be provided to contractors, bidders, vendors before submission. They may be penalized for minor errors. They may or may not know specific technical jargon that SNAP-Ed implementers might be used to, and so they might use different language. And if that language, if you're reading an application and that doesn't translate well, they might be scored less. And there's a lot of time that is spent on submitting those applications, submitting those contract documents, and none of that is funded. And so what happens is, you might unintentionally favor giving funds to bigger and more well-resourced organizations. And so that doesn't leave a lot of room for your smaller organizations or other organizations just starting out. And so we are encouraging folks who are in this position to really consider how we can expand that contract process. Next slide, please. So some key recommendations is offering smaller grants with simpler applications for organizations with less grant writing capacity. Kind of going through what is required from SNAP-Ed, what's required from your state or your organization, and really getting rid of all the other questions, any information that you really don't need. Giving agencies sufficient time for newer grantees to plan and test projects proposals. So you might start with, instead of implementing a project, maybe they are maybe doing a pilot test, maybe they're doing a needs assessment. So maybe sending out a request for proposal to do full implementation might not be the best. Maybe starting folks off at a needs assessment might be preferable. RFP review should consider the reach and priority populations. Again, this is an opportunity to address gaps in services. And so if you are working on a program and you're noticing we're not reaching people in this region, we're not reaching people from this population, there are organizations that are already working in that region, that are already working with those populations. It might be a really good idea to invite them to submit a proposal. Focus on a place-based focus, community-driven plans from organizations with authentic connections to the focus community. Again, really thinking through how exactly can we engage community members before application process. RFP should require that community input be included and documented. And this could be, in the form of focus groups, town hall meetings, listening sessions, previous work projects with community members, investing in community leaders. Those kinds of things are really good ways to gauge authentic community engagement. Panel reviewing applications. So the reviewers participating in racial equity trainings, and including community members and leaders in those in reviewing applications. All those with significant ties to the applicants can be excluded from the process. Next slide, please. And some other actionable recommendations, including adopting an inclusive contract process. Again, this is, creating environments for business owners owned by marginalized communities to participate in government funding. So doing more outreach that does, again, require some additional time and effort. Auditing current practices and regulations to ensure that necessary, what's necessary and what isn't, and eliminate what is not. Creating open bid contracting office hours. So this is before vendors and bidders submit a proposal. This will give them an opportunity to ask any questions that they have, to clarify any confusing questions from the application, and it gives them an opportunity to take the guesswork out of what that application is looking for. And then maybe carving out funds specifically for agencies led by marginalized people. Next slide, please. Providing technical assistance and training to newly funded agencies. So not just before that contracting process, providing technical assistance, office hours, and then after that onboarding process, making sure there's constant communication, there's monthly conference calls, or regular conference calls. There's ongoing training, and so you have an opportunity to build relationships with those new contractor vendors, and there's also an opportunity to familiarize new agencies with kind of the SNAP-Ed world and language. Clarifying an agency's principles and values for advancing equity and funding decisions, including in the guidance, presentations, and any external communications, and assessing the agency's capacity to contract with agencies through an equity lens, through an organizational audit, or key informant any reviews. So you can ask applicants, agencies, how was this process? Are there things that you would recommend that we do differently? So those are things that you can do to really think through how to make this the contracting process easier on vendors. Next slide, please. Some questions to consider is, how has your agency prioritized the voices of community members? How has your agency embraced an inclusive procurement process? And how has your agency communicated equity in the way that is clear and actionable? Next slide. Does your agencies have unobligated funds at the end of the federal fiscal year? Some agencies do, some agencies don't. If your agency consistently has unobligated funds, would you consider subcontracting for SNAP-Ed services with a community-based organization? Would you consider funding agencies that serve community members that are smaller, have less experience with federal or state funding, and or capacity building grants? Consider funding agencies that provide services to underserved populations. So if there are gaps in services that your agency can't provide, you don't have staff or bandwidth, or there might be other agencies that are already working in that area, they might just need some support. Would that be a consideration for your agency? Next slide, please. And I'll pass it over to Noelle. Thank you.
All right. Hello, everyone. Thank you so much for being here today. And I wanted to say a huge thank you to this committee and to Latresh for all the work that you've done to lead pulling this paper together. I think it's a wonderful resource and I'm really honored to get to be a part of this team of authors. So my name is Noelle Harden, and I am a regional health and nutrition educator at the University of Minnesota Extension. And I think it's important before I jump into the content to just say that about half of my position is funded through SNAP-Ed and half is not. So that has given me a lot of freedom and flexibility to be able to experiment with participatory grant making for about the last 7 or 8 years. And then to start to really think about how to bring these tools into a SNAP-Ed context. And next slide, please. So the chapter that I wrote is about participatory grant making, which is really a way to operationalize the values of our health equity framework and to bring the community into decision making. And specifically, participatory grant making focuses around decisions that are related to money. So we'll kind of focus on the grant making context today. But just know that these methods and concepts can apply to internal budgeting processes. You may have heard the term participatory budgeting, which is another way to talk about these concepts. So they are adaptable even if you're not doing external grant making. And this is a just graphic kind of showing that there are a lot of ways to approach shared decision making. And you can think about it as kind of moving along a spectrum from informing communities or staff about what resources are available, all the way to deciding together or even handing over the decision entirely to the community in terms of how the resources will be allocated. And on the next slide, the key points from this section of the paper are that participatory grant making really aligns well with our health equity principles. I highlighted integrity, transparency, and being accountable to community needs and strengths. But I also think that this really aligns well with centering people and how SNAP-Ed is implemented. And also really looking at authentic community engagement. I think what's really powerful about participatory grant making is that when people understand how their perspective and their hopes and dreams influence a decision about money, that's something that's really tangible to understand and can be incredibly empowering for community members and others who are involved in that. So this concept offers specific tools and methods to involve community members in decisions about money. As I mentioned, it's not just about grant making. We used in Minnesota Extension in our program, one year we allocated our professional development funds within our team using a participatory grant making method. So it can be adapted in a lot of different settings when money is on the table. And I have this graphic of a hatching egg here because I think that SNAP-Ed is in an early stage of exploring these ideas, of sort of incubating and thinking about how could these work within SNAP-Ed, given that sometimes the requirements for SNAP-Ed might be a little bit more stringent than other areas where participatory grant making has been used in philanthropy, in some local and statewide government. And then just a quick shout out. I know in Minnesota, there's a couple examples in the paper of how we've been sort of dipping our toe into using these methods in SNAP-Ed. And I know North Carolina, SNAP-Ed, Gabby, Chantal, it's been fun to brainstorm with the two of you as well about how these methods could work in a different state's SNAP-Ed context. So the paper includes this graphic, which just poses some questions and ideas thinking about the whole cycle of grant making and how community voice can be included throughout every single stage. And we've heard a couple examples already today of how inclusive procurement, for example, is a strategy that can be used around this application phase to encourage non-traditional or maybe smaller organizations to apply for funding. We can think about the awarding stage and how awarding grants doesn't need to happen in a black box, but it's something that can be a transparent process and a collaborative process where grantees and the community are brought together, or where a cohort of grantees can really be leveraged so that you're maximizing how much learning can occur between different projects and different organizations. And so in the implementation, the idea of having a learning cohort is really powerful. Grantees are likely to have similar challenges, be working through similar ways of engaging with the community. So there's just great ways to maximize that learning, and having that group be accountable to one another, and not always a sort of one-way path of accountability that's between the funder and between the grantees. And I know that we'll hear about participatory evaluation a little bit later, and just thinking about as you're asking grantees to report and share their successes, really centering the stories that they want to share, using tools like ripple effect mapping is a great way to kind of bring out those stories and successes in a way that centers people and centers the organizations who received the funds and the people that they work with. So the recommendations, again, this is kind of in the early stages of being brought into SNAP-Ed. So a lot of these recommendations are around, how do we support this in the SNAP-Ed guidance? How does USDA and FNS encourage people to think about using these methods and offer the resources for people to learn, and start thinking about how could this look like in my particular SNAP-Ed context. So it's kind of, in addition to being an egg that's incubated, it's sort of a chicken and the egg situation right now, where I think, do we have the guidance and the clear parameters about how to do this, or do we have experimentation happening, at the state level, at the community level? And really, it is about thinking about both of those at the same time as this gets integrated into SNAP-Ed. So at the state agency level, again, it's sort of how do we build the internal capacity around this? And I think looking at policies that exist can be really different state by state around how grants are administered. So that's a really important area to take a look at in these earlier stages. Networking is such a great way for us to learn from one another in SNAP-Ed. And there's also a lot of great work nationally and internationally in philanthropy to learn about what these methods can look like and how can they be adapted in a variety of settings. And then implementing agencies, supporting intentional funding that can build community-based decision-making capacity. In Minnesota, this sometimes means looking outside of SNAP-Ed and what are additional funding sources that we can leverage as we're in this early stage of adoption. And with, I think, all of our strategies around health equity, really looking at engaging community members most affected by disparities. So I will just conclude and leave you with a question to think about, which is, what is one action that you could take to include community in resource decisions? And I want to emphasize that, no action is really too small here. If this is your first time learning about participatory grant making, there are a couple resources that we can share after the presentation. I'm not sure if I can share them in the chat with everyone, but we have a website at Minnesota Extension, as well as a Journal of Extension article where you can learn more and even read about a few examples of what this looks like and how to take that first step. And you are absolutely welcome to reach out to me if you would like to learn more, and I can make sure that my email address gets shared, or you can find me through the University of Minnesota Extension. Thank you so much.
All right. Good morning. I am Jennifer Ward. I'm the program director at the University of Tennessee for both our SNAP-Ed and our FNET programs. So I'll be talking today about, backing up a little bit from these budget specific and kind of micro level issues and looking really at this macro organizational level. You'll go to the next slide. And I just want to acknowledge really quickly, as I've been listening and thinking about the things that we're talking about, equity as a whole is often really difficult to actually implement. We can think about it and to move it from talking about it and understanding it to action often comes with really, serious roadblocks. Sometimes those are people, sometimes those are, ideas and institutional level norms and practices, and going up against those can be kind of scary. They can have consequences. I know, working in Tennessee, there's definitely a climate around anything with diversity and equity and things like that. So I just want to acknowledge that and acknowledge the people in this room. I'm really excited to see how many people we have and the people here that are dedicated to, doing what equity and justice really demands. So organizational equity really is conceptualized in this paper, is mostly in terms of human resources and policy and those things surrounding it. But organizations are big, they are vast, and there are a lot of components that make it up. And so really my one takeaway here today is that in your place, wherever it is in the organization, that there are various intersecting opportunities and places of power to make changes. And in all of this, it's really important to understand that there are many axes of diversity and many differences that make a difference in organizations. So of course, in the field of nutrition security and food insecurity, we're particularly interested in how communities of color experience food insecurity differently than a majority or dominant populations. But there's also country of origin, language, gender, sexuality, veteran status even, first generation students, if you're ever working with students and things like that. So there's many axes of diversity. There's many differences that make a difference. So it's important to embed equity at the organizational level and policy because it translates to action and decisions, even when people don't have equity at the center, right? So as the program director and previously as an executive director in a refugee resettlement agency, I was writing policy about, maternity leave or family leave. And as we were thinking about that and making policy decisions, they might have looked race neutral or gender neutral at the face of it, but really the impact was different. And so at every level of an organization, the impacts are felt whether or not equity was considered at all. And I chose to write mostly about the human resource considerations because there's so much else happening in the paper, and it's really central to what we do. Now, it's not a new idea to hire a diverse workforce, and of course, that's a recommendation I make in the paper, but it is bigger than just saying, we want to hire a more diverse workforce and we want to look more like the people that we serve and represent people in the population. We are also concerned with retention, right? So after hiring, how do we keep people? How do we keep people meaningfully engaged in an organization, in a program or project? And what does it mean to belong or to be included and to feel comfortable doing the work? And to feel comfortable bringing new ideas and being considered. And then wages, of course, are extremely important. I write that it is unbecoming of an organization to create its own participants. And so it's really important, I think, to look at what is the cost of living where you work and live, and what are equitable salaries and hourly rates for people, because we do not want to be in SNAP-Ed making our own audience. Next slide, please. All right, so in hiring a diverse workforce, this has been a particular, something that we've been looking at in our program at UT for a while. And it's important to think about who is at the table when making decisions, how that actually happens. So we can say a lot, it's important to have a diverse team and to have paraprofessionals or agents in the field, educators, community educators, depending on where you live. But how does that actually happen? What is the hiring process? Who are the people on the committee? If you have a diverse committee, is everybody equally able to speak up? What are the power dynamics in the micro interactions that are happening at the table? I was just in a hiring committee a couple weeks ago where I had a decision to make whether or not I was going to say something. And I did, of course. It's very rare that I decide not to say something, but I made my opinion known, and I knew that there were a lot of things at play. This didn't have to do with this was like whether to do an internal or consider an external candidate and things like that. But there was another committee I was on where we were interviewing someone who had said some things that were just kind of like yellow flags, red flags that kind of pointed to things that were questionable. But the interview went well, and for the most part, and the paperwork looked good for the most part. And I just said, you know what, I just have this weird feeling, this particular phrase that was said was concerning to me, and I'm concerned about having this person go in and work with a majority Spanish speaking population in this particular county. And once I said that, it broke the ice. And that's kind of understanding some psychological concepts too of groupthink and needing just one person sometimes to break the ice and say, oh yeah, okay, I'm so glad that you said that because I was wondering about that too. We decided not to hire. There were consequences with that. We had that position open for a much longer time. We didn't, we had to move that position to a different county because it just didn't make sense anymore with the pool. But I believe that we made the right decision. I think also in hiring at every level, we want to represent the people that we serve, both in terms of class background, race, gender makeup, and things like that, and thinking about what the population is that is coming to our classes and who we want to reach more. And in all of this, at the center is thinking about belonging as it relates to retention and the daily work of equity. It is not enough to hire someone to have a start date and things like that. Equity is in mind at onboarding, training, and in meetings and in every space. Next slide, please. So in your sphere of influence, if you're making hiring decisions, if you're on committees, if you're making staffing plans or looking at data to inform someone else who's making a staffing plan, you can think about these questions. So how accessible is the hiring process? We were looking at hiring people who came to the United States as refugees, and our hiring process honestly can be really clunky in a university and kind of difficult to navigate. So what can we do to make that easier and more obvious and intuitive? How are hiring decisions made? So who is at the table, who is asked to be on committees? And remembering we don't want to overburden people. So if you would want to make sure you have a racially diverse committee, to make sure you are avoiding tokenism or avoiding overburdening any people of color on your staff and having those conversations. What qualifications are really necessary? So back when I was doing my gender studies degree as an undergrad, I remember a professor asking a question, do you think women should be firefighters? And everyone's like, yeah, of course. And the idea was that, well, anyone, and there's some people like, well, if they can meet the physical requirements necessary and do the tests. And there had been a history where more women were not able to meet the physical tests or pass those tests to become a firefighter. But they were being tested on things that weren't really necessary. They were making the bar, they were putting the bar in a place that didn't make sense for the job and what needed to be done. So what qualifications are really necessary? What is just historical and normative? What might be able to be changed to be more inclusive and recognize the various educational and privileges that have been in the past for people and people's pasts? Is compensation appropriate? So like I said, is it a living wage where you work and live? And do race and gender analyses. So after the fact in a staffing environment, do regular race and gender analyses reveal inequity? Make sure your institution is doing those things and looking at it. There are statisticians that can help with those models. Now it won't reveal everything. Like if you come up with a Z-score and do kind of a meta-analysis statistical model, it might not reveal individual level inequities, but it can give you a bigger picture of what's happening and a place to start making changes and decisions. Next. All right, this is where I get really excited because I love intercultural development. So intercultural development is a widely validated and reliable instrument that many of you have probably used. It is used at hundreds of universities and organizations. And I think it's a really great way to look at organizational development and intercultural competency. And so really it is making helping us make the decisions about what to do in policy and in planning and project management, to recognize the differences that make a difference in our areas and what to do about that. So you can take an IDI assessment as a group or an organization and get a group score. It also includes individual scores for people. And so people generally, this is great too, because it's a developmental continuum. So it's super hopeful. So you can do an intercultural development plan and move along this continuum. I highly recommend having someone in your space or contracting out with someone who is a qualified administrator to do this development inventory. It is extremely illuminating. So I won't go through all of the stages, but essentially the goal is to get to a more intercultural mindset as a group and also as individuals. So I am a qualified administrator. I love to travel. I'm happy to help. I'm happy to also help if you want to become a qualified administrator, look at things. I am not selling this. It's actually very reasonably priced because they have to, they have to make it work. They have to have, a whole system, but it's very reasonably priced for nonprofits and education settings. So let me know if you're interested in that. It comes with a lot of coaching, and it helps you identify areas of need and an action plan to move along the continuum and come closer to adaptation. Most people actually fall in the minimization category, and acceptance is like, we're really curious, but we value difference, but we're not really sure what to do. And an organization that's at the adaptation level really values and understands everyone's cultural differences and similarities and finds ways to be the most effective. So I highly recommend this. It's a really great way to go. But the brief is the intercultural development plans include travel, site visits, reading, training, and things like that. Because we know one training doesn't always make a difference, but a very intentional plan to move along this continuum to deepen our understanding of our own culture and other people's cultures with which we're not as familiar, is really important in making sure that we have the biggest impact that we can. In my training, they said, do I want to be right or do I want to be effective? Do I want to be, what is my goal in the organization? What is my role and what can I do without losing my soul? And I really, really loved those. Those are not my quips. I got those from the training. So this is at the organizational level, some things that you can do. And that is all for me. Thank you all so much.
Centering Equity in Developing Culturally Relevant Programs was authored by Stephanie Parker. Unfortunately, she could not attend today, but it is a really great chapter around how we can modify our programs to ensure that they are culturally and linguistically relevant. Next slide, please. Chantal Rose.
Thanks so much. Thank you for everybody who's presented on their portion of the paper so far. If you haven't noticed yet, there's a lot of intersecting ideas, a lot of overlap, a lot of commonalities. And so hopefully you can start to pull out some of those things that are resonating with you. Advancing equity through evaluation. Really, my section is a broad introduction that posits that evaluation can be an incredibly transformative tool to advance equity in our organizations and in doing SNAP-Ed work. As SNAP-Ed professionals, we know that evaluation of our programming is a really big part of our grant funding and our programs, and it's essential really to ensure fidelity, to assess the effectiveness of our programming, both on the delivery side and our approaches. And it's really critical for learning and improving our efforts to make sure that we are meeting the stated goals and missions that we have put forth. When we say that we are striving to advance equity, I believe Amber said it as well, but it means achieving systems change so that advantages and disadvantages based on all intersections of identity across all social groups cease to exist. And so it's really looking at what are those small little changes that we can make to ensure that our priority communities are centered. And because nutrition security and physical activity can't be disentangled from many of these identity issues, evaluators have a very unique role in being stewards and being change agents to ensure that we are accountable to the communities that we are partnering and working with. So this requires that evaluators take a very active role. In the essay, one of the first things that I do is talk about just the historical context of evaluation as a scientific discipline, as it's evolved, you know, amidst a very Eurocentric, Western, white-centered environment. We are all subject as individual evaluators, as staff members, to perpetuating structurally racist and unjust systems. And so it's important that we critically examine those historical, current and historical practices, those normative practices, those things that we say, oh, this is just how we have always done things, or this is how I was taught in school to evaluate and do research. But being really critical and being able to interrogate those mindsets and approaches. One of the things that you'll see in the paper is just a comparison between some different mindsets, approaches, and characteristics. You'll see on you know, in typically transactional relationships or transactional approaches, they tend to be very program centered, hierarchical from top down, looking from small groups of experts, generalized to larger groups. Taking a more equity-focused relational approach requires that we look more person-centered. A mindset shift from this idea of ownership to stewardship and consent. Moving our evaluation mindsets from a reductionist, aggregate, generalizable frame of mind to something that's more holistic, that embraces more complexity, more localized context. Removing this idea of objectivity and neutrality, and understanding that we are all subject to bringing bias and assumptions. And so how can we really put together processes and things that will allow us to check those biases and assumptions individually, and appropriately include context relevant to our programs. Some of the key points that I make in terms of advancing equity through the use of evaluation is, again, acknowledging that these systemic biases on individual evaluators and within the scientific field as a whole exist, which highlights this imperative to shift towards person and place-centered mindsets and methods. It really encourages us to, as individuals and as organizations, make that commitment to naming equity and doing everything that we can to reveal systemic drivers of inequity, going beyond the generalized, stereotypical reasons that we think of for people to not have access to nutrition security and opportunities for physical activity, but digging deeper based on specific cultures, populations, and locations. As Jennifer just talked about, hiring diverse staff is really important, and that includes evaluation teams. I know this depends on your agency, but however we can engage individuals in the evaluation effort is really critical. So moving beyond individuals with even diverse identities, but engaging staff at different levels, different community partners and community members most affected by the barriers, and allowing community members to really shape what is evaluated and how things go about being evaluated. Another really key part of evaluation is, as we've mentioned, moving from transaction to relationships, building authentic long-term relationships. I think in traditional evaluations, we tend to see evaluation as something that comes at the very end. Oftentimes it can be a last minute, like, okay, we've got to evaluate this, or, oh, we need a story for this report. Those are inequitable practices. We really need to start at the beginning in strategy and planning, taking time and effort and resource to build and maintain relationships. And as many speakers before me have said, really investing in community voice and really asking questions and getting curious about what their lived experiences are and what their perceptions and truths are in terms of what their barriers are, so that we can get to the root causes of what is affecting the communities that we are seeking to work with. Through these authentic relationships, we can really begin to understand the impact of culture and context on the work that we do in our SNAP Ed programming, and find ways to adapt and be more effective. Additionally, as I said, again, evaluation really starts from the beginning and happens throughout the entire life cycle of what we do, whether it's planning, whether it's implementation, not just what we're implementing, but how we're implementing it. Again, Stephanie's paper in discussing how to adapt programming is really critical. And part of that is adapting how we go about evaluating some of these things. I know it's critical that we use evidence-based interventions. We've got an incredible evaluation framework. So how can we start utilizing these to advance equity and make sure that we are adapting things for the communities that we're working with? Equity and evaluation really asks us to be thoughtful about the evaluations that we use and how we go about collecting data and doing those analyses. There's a variety of methods that I know have been mentioned today and are mentioned throughout the paper. Ripple effect mapping, rapid qualitative analyses, photo voice. A big thing that we do at the University of North Carolina in Chapel Hill is design thinking processes that really engage community members as co-creators to the problems that are that these communities and individuals are facing. And so being thoughtful in the way that we do that, prioritizing diverse ways of knowing. One of the manifestations of these transactional relationships, hierarchical relationships, supremacy, oppressive relationships is this worship of the written word. You know, we do a lot of surveys, but how can we shift that and still collect valuable information from our communities in ways that are more meaningful to them? So mixed methods with emphasis on storytelling. It asks that we, of course, take care for confidentiality, making disaggregating our data the norm, examining differential outcomes based on race, ethnicity, and other identities, really using that data to identify structural drivers of these inequities, being transparent about the data that we're collecting and how we're using it, sharing that data so we don't overburden communities, discussions around data sovereignty and who owns that data. I think it's also really critical that we allow the communities that we're working with to play an integral part in the sense making of the data that we collect, and helping us craft those narratives and understand really what the data means for these impacted populations. Equity and evaluation includes a deep understanding of that context and the power dynamics that are involved. And then when it comes to reporting and communicating our findings, again, it's important to have continuous consent from our communities and continuous involvement. Data doesn't speak for itself, and it's not necessarily neutral or objective. That context really is critical for an accurate and ethical analysis. And so our community is a really critical partner that needs to be at the table when we're doing, evaluating the work that we're doing. Data, in my opinion, is story. It tells a story, the context fills in the rest of that story. And another important part of that is that the words and the narratives that we use are really critical. And so the reports that we send out not only need to be crafted for multiple audiences, but also in ways that are beneficial to everyone. In terms of that language, I believe that evaluation and reporting really should promote inclusion and reduce stigma. And so we need to be very intentional about the language and the narratives that we use. The As an Evaluation Reporting Committee recently published an ethical storytelling and asset framing toolkit, which reviews the two main topics of ethical storytelling and asset framing. It provides examples and resources to apply to our evaluation and data practices. And it also includes an updated SNAP and Works report template. This is available on the ASNA website, and there will be future iterations that continue to provide specific examples around our SNAP and work. But as evaluators, the way that we frame our evaluations, the way that we tell the stories about these communities that we work with, hopefully it's the community sharing what they want to share, what they're excited to share, and the way that they're willing to share it. Hopefully it's in ways that promote dignity, sustainability. Ultimately, as evaluators, we are stewards of this data. It's not our data to own and use. And we really need to be mindful of the way that we're advocating for our communities, the way that we are retelling and sharing these stories, and doing so with consent and respect. A couple of questions to consider when we think about evaluation as a tool for advancing equity. What shifts in planning, programming, data collection tools, and evaluation methodologies need to occur to ensure meaningful relationships and community voice, consent, and ownership are prioritized? In what way have we adapted our evaluation approaches based on different priority populations and cultures? To what extent has the community been involved in the planning, data collection, sense making, and reporting processes? And to what extent have we connected disparities and community-wide problems to systemic causes? Do our narratives reinforce harmful stigmas and stereotypical narratives, or do they promote individual and community autonomy, respect, and dignity? And of course, how does each priority population perceive our communications? Just a couple recommendations for action in terms of USDA and FNS influence. Consider providing additional funding and technical assistance for the development and use of culturally appropriate, culturally relevant, equitable evaluation methods, and encouraging the development of explicit equity processes and outcome indicators within the SNAP-Ed guidelines and within the evaluation framework. And at the state and local agency level, consider working to ensure that the hiring and development of diverse evaluation staff occurs. And honestly, evaluation, hopefully we can work to develop a culture of evaluation where everybody is an evaluator. So building that capacity and also building the capacity of the community to be involved as co-evaluators. How can we ensure that our community or priority populations are directly involved in all stages of the evaluation process? And how can we, encouraging state and local agencies to really incorporate local context and use their evaluation findings to reveal and address the systemic drivers of inequity and barriers to food and nutrition access, opportunities for physical activity at the community level. Making intentional efforts to essentially interrogate the way that we've always done things as evaluators, the way that we frame and plan and approach, how we evaluate our programs and work with communities will ultimately enable us to better support individuals and families and improve the wellness of the communities that we're seeking to work with, and hopefully reduce those inequities that we're seeing in these communities. I believe that's it. Sarah is not here with us today, but she's going to go a little bit more deep into topics around equity-centered evaluation and the evaluation framework itself. And she actually provided us with a recording of her presentation. So we're going to go ahead and play that now.
Hello, my name is Sarah Mishak, and I'm a co-chair of the ASNA Evaluation Committee, and I'm presenting today on the evaluation section of the ASNA position paper on the role of evaluation and equity promotion. And I'm presenting on behalf of myself and the other co-chairs of the ASNA Evaluation Committee, Sandy Sherman and Heidi LeBlanc, as well as members of the Evaluation and Reporting Subgroup of the Evaluation Committee. before we really get started with the position paper, I just want to say that promoting equity through evaluation really aligns with the goals of the evaluation committee. And the first goal of our committee is to apply equitable evaluation principles and practices to inform SNAP-Ed co-training. So when we talk about evaluation in SNAP-Ed, it's usually good to start with the SNAP-Ed evaluation framework, which was originally developed to help SNAP-Ed implementing agencies towards eliminating disparities that contribute to poor diet, physical inactivity, food insecurity, and obesity. So health equity was a part of the framework from the very beginning. However, we acknowledge that there's room for growth to center equity and justice as core principles, and also to explicitly would allow state agencies and implementing agencies to explicitly eliminate or reduce health disparities through their evaluation work. We do want to talk about expanding the SNAP-Ed evaluation framework to focus on health equity. And in the position paper, we go through two different approaches, one of which would be to use a transformative lens or paradigm when interpreting the SNAP-Ed evaluation framework, and the other would be to add health equity focused indicators within the framework. And both of these are not mutually exclusive. So starting with the use of a transformative paradigm, this is where you could adopt an equity lens when interpreting the framework. It would really encourage folks to think about social inclusion with their evaluation practices, participatory processes that build trust between evaluators and communities, the incorporation of equity-focused evaluation methodologies that are really appropriate to context and groups involved, and also the use and dissemination of evaluation results to promote social justice and health equity. Another approach would be to incorporate health equity focused indicators, and there are pros and cons which are worth mentioning in this approach. Pros are that it really provides an entry point for incorporating health equity in evaluation plans when you have a specific indicator to use. It would also really allow states and implementing agencies to establish baselines and track their progress in working towards health equity goals. And if a health equity focused indicator is named as a priority indicator by FNS, it could result in really wide uptake of this indicator. Cons, however, would be that incorporating a specific indicator could imply health equity does not need to be considered with the remaining 51 indicators. And it could frame health equity promotion as a box that can be checked rather than an ongoing process, when really you can use the health equity lens with most, if not all, of the indicators. So when thinking about updating the SNAP-Ed evaluation framework, we do think it's important, and it would fit with the USDA's focus on nutrition security, but that this really should be a collective process with FNS, ASNA, state agencies, implementing agencies, and outside stakeholders. And that if community partners and participants are included from the beginning of any updates, that it could really be an opportunity to include Indigenous, feminist, intersectional, and disability rights perspectives within the framework. And it would be important to get these perspectives early on in the process. So now we'll go into our specific recommendations that we go through in the position paper, and these are broken out by state agencies and implementing agencies, and then by our recommendations for FNS. So for state agencies and implementing agencies, we suggest that they do start to use that transformative lens or paradigm for the development of their evaluation plans, and that they should incorporate community voices and perspectives within evaluation plans and designs. They should also design evaluations to limit burden on community members and collect data valued by community members that can be used to highlight community voices and uplift issues of importance to community members, as opposed to issues that may be more important to funders. And state agencies specifically can also include equity-focused objectives in their plans to encourage implementing agencies to focus equity within their work. Our recommendations for FNS would be to build state agencies and implementing agencies' capacity for health equity work by including information on health equity and a transformative paradigm in future trainings and through ongoing technical assistance. To provide or highlight training opportunities for SAs and implementing agencies on using approaches that center community voices. To require the use of an equity lens for priority indicators, to encourage state agencies and implementing agencies to include a health equity lens in their evaluation plans, and also to support the inclusion of participant and community voices in any updates of this evaluation framework. And we look forward to you reading more about our focus on equity in the ASNA equity position paper. Thank you. Hello, presenting today on the evaluation.
Hey, hello, this is Hyunjun Kim. In this section, we are going to discuss the participatory evaluation, which is already talked about in many different sessions. So I don't want to keep talking about the same things again, so let's keep it simple. At its core, participatory evaluation views evaluation as a learning tool to foster social justice. Instead of just being subjects of evaluations, SNAP-Ed participants and partners are actively involved as co-learners and co-evaluators and use the evaluation experience to improve social justice. The aim is to build a deep, meaningful learning relationship between SNAP-Ed and the community. Participatory evaluation values the building trusting relationship over individual behavioral changes without having that relationship and deeper understanding of community. We cannot achieve our overall goal and sustain our intended outcomes. So participatory evaluation encompasses the active involvement of community members in every stage of evaluation, from deciding on participants to analyzing the results and reporting. It values the local knowledge and lived experiences of community members. The key benefits is cultural relevance, community buy-in, empowerment, and a sustainable relationship between SNAP-Ed and the community. While traditional evaluations often fall short in stakeholder participation, transparency, and sustainability, they can also perpetuate power imbalances. Participatory evaluations prioritize stakeholder involvements, promoting trust, accountability, and responsiveness. There are multiple techniques and methods for participatory evaluation. For example, photo voice, participatory asset mapping, or needs assessment, appreciative inquiry, and ripple effect mapping. Next slide, please. Next slide. Okay, participatory evaluation aligns with RHSE's equity principles, centering people, not just program evaluation data. In many cases, reach count or some behavior changes. Participatory evaluation center people, not the data, center people by valuing relationships and trying to really understand how people interact with SNAP-Ed programs. And engaging communities authentically. No one likes to be evaluated or judged by others. Inviting participants to evaluate the SNAP-Ed program, we respect participants' life expertise and honor their lives. Not judging participants' lifestyle is wrong or unhealthy. Then prioritizing impact over intent. Even our evaluation tools have a great intent. Often those surveys or measurements harm the relationship between SNAP-Ed and the community. To make sure that our evaluation tools and methods are culturally relevant and honor community, we need to consider participatory evaluation. Adapting an asset-based approach. Participatory evaluation assumes participants have capacity and access to evaluate SNAP-Ed programs. We are not starting from deficit model, but starting with assets of participants. Next slide, please. To implement participatory effectively, SNAP-Ed organizations, including FNS, should offer technical assistance. It is still an emerging stage in Minnesota SNAP-Ed and others too. It would be helpful if we can get technical assistance from the national office. Also, through national offices or communication channels, we can share experiences too, and through ASNA too, ASNA Evaluation Committee. And allow allocating funds to support participatory activities like community dinners and trainings, which is very necessary for participatory activities. As we wrap up, remember that participatory evaluation isn't just an approach, it's a commitment to involving communities in creating solutions that work for them. Thank you for joining.
Hey, thank you so much to each and every one of our panelists. I just want to leave with some final thoughts. Each and every one of you on the call and throughout ASNA are all change agents, and we just ask that you explore your positionality within your sphere of influence. Advancing equity requires vision and, most importantly, action. We encourage you to explore ways that you can center equity in the work that you do. And a special thank you to every single person on the Race, Health, and Social Equity Committee for their tireless commitment to reviews and time and effort that you spent on making this project a reality. So we're just about to hit time. So the position paper is planned to come out by November 17th. Be on the lookout. And please complete the survey after the webinar. Next slide, please. We had a couple of questions and answers. And if you can stay on the phone call, feel free to do so. But we have reached time. And we'll be able to share out that Q&A again when we send out the email after the webinar. So be on the lookout for the email, be on the lookout for the survey. Please complete it, please, please, please. And we'll also make sure that you'll know where the presentation slides and the recorded presentations will be located. And we can start recording there.